morning. You here for Dr. John's class?
I am, yes.
Yes, he'll be here shortly.
It's gonna be.
It will be in here, yeah.
Perfect, thank you.
Of course.
presentation today? Yes. Ah.
There you are.
You know, sometimes the Lord said, let there be light, and then he said, let there be sound. Indeed. Okay, so on behalf of Fellowship of Christ, I'd like to welcome you all here for my presentation, Designed for Health. And last November, I gave a two-part series called Food, Friend or Foe, a Biblical Perspective and a Common Sense Approach. And that was going through the chemical aspects of how our bodies get to a point of disease and how you can reverse that and allow for your body to get healing where you're in distress otherwise. And it's an interesting process in the sense of the body has very specific attitudes toward different influences. So if you are doing something consistently that is irritating your nervous system and therefore the health of your body, there's a high probability there will be symptoms, and those symptoms will be wherever the weak link is in that person. We all have different areas of distress, different emotional, physical, chemical stressors that will influence the body. And back in November, we talked about the chemical aspect. Today, we're going to talk about the physical side and what you can do to help yourself if you're feeling pain, whether it be physical or emotional distress. And before we get overly started, I want to just pray. So, dear Lord God, Heavenly Father, we praise your name and thank you so much for each and every day. We thank you for your Son, Jesus, Lord, and the fact that you gave him to us as our Savior, our Sanctifier, our Redeemer, our King. And Lord, he is our great physician. And we ask, Lord, that you just allow for his healing to be here today, to work in us and through us, so that we may better understand how you provided for our bodies and how we can deal with any issue that comes our way when it comes to health. We ask this in your Son, Jesus' name. Amen. So, there are multiple influences that can affect the health of the body. I'm a chiropractor. I've been practicing a technique called applied kinesiology since I was 9 years old. So that's roughly almost 60 years. And we look at the body as an equilateral triangle where the base is our structure, one side's chemical, the other side's emotional. And if you draw a circle around that, you've got your spirit. So if any one of those equilateral sides is out of balance, it will affect the other two sides. So we talked about the chemical side. Today we're going to talk about the structural and emotional side. If you get two of the three in balance, don't you know the third side has to come around. That's just normal equation for equilateral triangle. Two sides equal, the third side's got to be equal. So we discussed in November the chemical side. Today we're going to talk about the influences of the physical side. We're going to teach three different techniques. They're simple. Sadly, my brother designed, not sadly he designed it, he designed the first two techniques, but when teaching this, I find out that the best doctors that I know in my profession rarely use these techniques, probably because they are too simple, probably because they're easy to overlook. The body is designed to treat itself. Are you aware of that? The body is designed to treat itself. I will give you examples. If you are in emotional distress and you are weary and your hand is in your forehead or you're rubbing your forehead, as I do quite often when I'm in distress, there are emotional reset points in the center of the forehead above the center of each eye. They're acupuncture points, actually. But they're there specifically to calm the system when we're in distress. When you have an injury, you hit your thumb, you shake it, or you bump something, you rub it. There's something called mechanical receptors. Those mechanical receptors are dampened when you rub them or shake them, so that the pain neurologically is reset in the body. It does it naturally. We do it just out of an ordinary sense of reflex. So if we have different types of influences, the body's designed to treat itself. If we have an itch, and yet there's no bug bite or no bump of any kind, we're probably stimulating a reflex. Those reflexes are like switches in the body. They help reset the nervous system. So I want to show you how to reset your nervous system, because the nervous system controls everything in the body. Now, the other half of that is the digestive tract rules. So if you fail to have a healthy diet, which we went through 3 months ago, then you are going to ask your body to fight itself. And it's a tug of war. And we don't have that one recorded. I think we're trying to record this one. So when we have negative influence on the body, there is always a cause and effect. So we have a negative input, we rub an injury, the problem, it feels better. You might have a bruise from it, but it still feels better. The body's designed to heal itself. It's not happening. There we go. So this is a slide I used in November. If you diligently heed the voice of the Lord your God and do what is right in his sight, give ear to his commandments and keep all of his statutes, I will put none of the diseases on you for which I have brought on the Egyptians, for I am the Lord who heals you. Now I went through my concordance, which was an NIV. These are all coming from NIV, these scriptures. And there were 57 different Bible passages that had to do with heal, healed, healing, health. And then I was going through another concordance, and there were more. There were like almost 60. So there are 57 in one concordance in NIV, and more than that in others because the translations are different. So the term healed, healing, health, they translate differently from one translation to another. So depending on the Bible, you'll have somewhere around 60 different categories of healing in Scripture. Just to remind you, for those who were here for the last presentation, the same diseases that the Lord had brought on the Egyptians, when they exhumed the tombs, they found cancer, heart disease, stroke, blood clots, things of that nature. We haven't changed. We're human beings. The same influences of distress affect the bodies the same way 3,000 years ago, 4,000 years ago. It hasn't changed, sadly. But ultimately, there are things you can do to help yourself work through a lot of the distressful aspects in life. So, fear not, for I am with you. Be not dismayed, for I am your God. I will strengthen you. Yes, I will help you. I will uphold you with my righteous right hand. And so God is here with us all the time. We want to be reassured that we are feeling well and that we are living well, and we have the opportunity to just shine brightly for the Lord. What happens when we don't? What happens when we feel horrible? What happens when we have constant pain? What happens when the stress is so much we can't handle it anymore? Well, he's still there, but maybe it's because we fail to understand how to help our own bodies, and maybe it's because we're making poor choices, and we don't realize they're poor choices. If you fail to make proper choices, there's always repercussion in the human system, always. You drink bleach, there's a bad repercussion on that. You drink too much alcohol, well, not as long-term of a repercussion, but you'll feel it the next day. I'm not saying you shouldn't drink the alcohol. Certainly don't drink the bleach. We need that because the liabilities are just too big. You've got to give yourself the opportunity to heal. So we're going to talk about the mechanics today, but these are just a couple Bible passages that I wanted to give you because when we're weary, it's not that we forget about the Lord, but we forget about how the Lord is in us and can work through us and utilize his love to heal us. Now, as a physician, I have been blessed to have the Lord working in me and through me to help others. It's real hard to try to retire. It's very difficult, by the way. I've been trying to retire since last year, and it's not working out. But to have the love of the Lord work through you into other people, ministers understand that, healers understand that. It's I won't say it is addictive, but it's a different feeling when you don't do that every day. You have to find other ways to promote the love of Christ. Healing is one way. Helping others is another. There's so many ways the Lord wants to work through us to use our gifts to help others. Because that's really one of the reasons we're on earth. So injury recall technique, the history and the injury of trauma. So we have trauma, and you've been in a car accident, you've had a fall, and it takes how much time for your body to recover from the whiplash or from the bone and bruise injuries that you had? Longer than we'd like, I guarantee it. I blew my knee out snow skiing. I overjumped a landing. I flew 35 feet in the air and landed flat, and that hurt. My knee popped. It's not supposed to pop. So that took a long time, but I knew how to reset myself. So I'm in Steamboat Springs, which I'm going back to next Saturday. And I had no pain in my knee. I tore my ACL, and I obliterated my medial meniscus. They usually have to carry you down in a toboggan for that. Well, I wasn't going to take that ride. I've been skiing one ski just in case I was stupid enough to hurt myself for years. And I did. Ski down on one ski. So it didn't change the injury. I still had to have the surgery for my knee. But the pain wasn't there. Why? Two reasons. I reset my nervous system immediately for the mechanoreceptors we talked about, because they were just completely inflamed. And two, I don't put things in my body that create inflammation. So if you don't have inflammation, by default, you have healing. And there are a lot of things we put in our bodies that, quote, taste good, and maybe they even on paper they say they're healthy for us, but they may not be healthy for each individual. How do you find that out? Well, that's what I do all day. But there are specific ways you can identify good, bad, and indifferent. So my brother developed this technique and the second technique. These are simple techniques. I'm going to go through some of the history. This is what, when I teach, this is how I describe it. And I've taken out some of the more difficult slides, but I thought maybe you should understand how your body works a little bit. Because nobody teaches this stuff. Okay, there's a muscle chain response. Dr. Robert Crotty, who was a doctor of podiatric medicine in Oklahoma, taught 6 people how to reset the nervous system using podiatric type of procedures. Gordon Bronston in Lathrop, Michigan, was a friend of my brother's. And he was a friend of my brother's not because he knew him for a long time, but because my brother had a patient and then 2 and then 6 come up to him and say, you know, there's a doctor I think you should meet because he does the same kind of weird stuff you do, only different. And my brother heard that once. He goes, yeah, okay. Hears it twice. He perks his mind. And when he hears it like the 6th time, he says, I got to meet this guy. So he meets him. And they teach each other. That's, people who are at the top of their game, whether they admit it or not, they don't hold back information. They share it. They share it because it's not a privileged set of information. It's universal. People should understand certain sets of information. So not just between docs, but between other human beings. So Dr. Bronston was in Michigan. My brother was working in Michigan at the time. We grew up in Michigan, just outside Detroit. So there are 2 types of injury recall technique. One's for the head and neck, and one is for the rest of the body. They are simple. The technical stuff I'm going to describe is not to confuse, it's just to let you know there's reasons and rationale for everything. There's no test, okay? There's no test. Is there anybody here that has acute and or chronic pain at this moment? Of course. Come on. Yeah, you get to be the lucky one. I'm going to show you how difficult this is. Where's your pain, if you don't mind telling me?
It's my bursa in my knee.
The bursa in the knee, so medial knee. So go ahead and have a seat right here for a second.
Ah, it was high for me.
I know, it's a little high for me too. So it's the left knee?
Yeah.
Okay. So there are ways to muscle test for this, and that's what I do with applied kinesiology. I'm not going to teach you muscle testing. That's about a 180-hour course. We have two. We have two. So what does it hurt for you to do?
Walk on a treadmill, go walking.
What about bending, squatting?
I can do a bike, no problem.
You can do a bike, no problem.
Yeah, I mean,
Yeah,
when I was walking to the gym.
And is it hurting right now?
No, because I'm not working it.
Okay. Is there anybody that has something that's hurting right now? Come on up, Kristen. I'll catch you in a minute. Okay. What is hurting right now?
And then it's reverting, like giving me a headache.
Okay, have a seat.
Okay.
So, all you have to do is reset the nervous system. And when you reset the nervous system, you're going to flip a switch that allows for something that's interfering with normal function to be reset so normal function can occur. What does it hurt for you to do?
It's like certain movements, I don't know, like I'll turn my head and I'll feel like a sharp pain.
Mm-hmm. Can you do that?
Can I move my head? Yeah, it's like it comes and goes.
Okay. Put your hand right on it.
Huh?
Put your hand right on it.
I'll just put it where it hurts my neck.
Yeah. Okay. This is it. This is tough. Relax your head. That's it. Anything from the head up, you can put your hand on the area of involvement and just toggle the anteoccipital area, which is the base of the skull. Just like that. You only have to do it once. It's very slight. Move your head and see if that's any different.
Yeah, it's better.
Okay? It's a switch. We're neurologically electrical. Are you aware of that? Our nervous systems are electrical in nature. Otherwise, we could not get an electrocardiograph of the heart. It's electrical output from the heart. So, if we're electrical in nature, we can short circuit. What short circuits the human system? Physical stress, chemical stress, emotional stress, thermal stress, which we're having a lot of this year in North Carolina, electromagnetic stress, and toxic stress. Those influences interfere with normal function. There are others, but those are the major categories. I'm done for the moment.
Okay.
Yep.
Hey, John, did you put one hand on the back of the head, or you just put it on
I have one hand at the base of the skull,
the face, and then the other one?
and her hand would be on the injured area. Now, what if the person can't reach, or what if they're too small to understand it? Well, very simply, you can tap over the area or rub over the area and flex the head at the same time. It's literally that simple. It resets the mechanical receptors for that area faster than just rubbing it by itself. It goes straight to the brain. Now, if you have a lower body, anything lower, shoulders and lower, you can do the same thing with the upper neck or with the feet flat on the ground. So if they're sitting or standing, we could have done the same thing. Got the left knee over here. We could have done that, and it will reset the nervous system. Now, that sounds very strange, but it works that way because that's what we found out through Dr. Crotty, that there are switches. There are switches in the talus bone. The talus bone's in the foot. My brother Walt discovered the head-neck relationship for injury and resetting. So, you therapy localize. TL is therapy localize. So you put your hand to the area of the previous trauma. If it is negative, well, that's just a way to muscle test for it. Patient, therapy localizes the area while the doctor flexes the atlanto-occipital area in the direction of impact. So if you have a whiplash and your head goes sideways because you hit broadside, you're going to have the head flex to the side while holding the area of injury. Okay? Yes? The occipital bone, not lobe, occipital bone, which is the base of the skull. No, the patient puts their hand on it, and if the patient is not able to put their hand on it, like I've had 7 surgeries in the last 8.5 years. I'm kind of not with it for the first couple hours. My brother was there for most of the surgery because he passed in 21. And he was there resetting my nervous system within hours of my surgeries. My surgeries are all genetic. It's not like I planned it, other than my knee surgery, which I didn't plan that either. But the body will reset itself if you give it the opportunity. Why doesn't do it on its own? It does. The body will reset itself on its own. Well, how come it doesn't if it can? The more interference that we have neurologically from physical, chemical, emotional, thermal, electromagnetic, and toxic stress, the less likely it's going to reset itself because it's confused. The nervous system gets confused. We all have people that we are aware of that have specific choices they make, and we're saying, why are they doing that? They should be doing the exact opposite of that. Those people are confused. They have nervous systems that do the exact opposite, and they don't heal very well. These are the angry people, or the irritable people, or the people that can't get out of their own way for their stress. And that's because they have so much accumulated stress, their bodies can't sort it all out. Different genetics give you a bigger shield for impact, for stress, and some don't have that. Some have a very thin shield. So that's just the way we have been developed, in the womb from different genetics, from 2 different people, and then how many hundreds of people before them. But this is what we get, and it boils down to what you have available to heal. And what you have available is just who you are. And you want to be able to give yourself the best opportunity to heal. Okay? So that's what we're here for, is give you the best opportunity to heal. So, as an example, this person got broken nose. It's literally just a little head flexion. You're not torquing the head down. It's a little head flexion while you're localizing to the area of injury, which in this case was his nose. And that takes the pain away. It just flips the switch. That's all you have to think about. The neurological aspects are significant, but it just flips the switch. So, for the rest of the body, the talus bone, which is in the curve of the foot. Where is the talus? I'll show you pictures, but it's right here. Okay? It's right at that angle. The patient or the person, therapy localize the area, or you can pinch over the area, or you can use a cold spray if you want. You can rub over it. That's muscle testing yet, but I just want to show you different areas, ways that you can help reset the nervous system. Okay. So you gently distract the talus inferiorly while the person holds the area of injury. Is there anybody having a shoulder down pain right now? You guys are all too healthy. Anna, you have something? Oh, well, that's a little different. So, come on up with your knee. Is it Kristen? Okay. Robin. I knew there was an IN in there somewhere. Come on in. So this is what we would do. Have a seat. You can do it standing also. Again, if the feet are flat, you can flex the head down. But what if they're, in a seated position? You can put the hand on the knee. You just take the foot, shoe or no shoe, doesn't make any difference. sock or no sock, doesn't matter. All you're going to do, relax your foot. That's it. You're just toggling the talus bone down. I'll show you where it is here in just a second. But it's just, you get into the arch, you just a finger to give you some leverage, and that's it. And that resets the nervous system. Okay, it's that simple. That's it. That's it. So it could be a shoulder. It could be a shoulder. You just toggle on the same side as the injury. What if it's midline? Well, I've had a couple surgeries midline, so you do both sides if it's midline, left and right. But if it's more predominant, if it's the right knee, then you do the right foot. If it's the left knee, you do the left foot. If it's center, you do both feet. It's very simple. We'll demonstrate this on each other in just a minute. Okay. So, again, this is what it looks like. Your finger is just going to be right in the angle there, and you're just going to toggle the foot down. I'll demonstrate on each one of you so you understand. And if you try to torque it too much and pull on it too much or over reset, it may or may not work. You can put too much information into the nervous system because it's highly powerful what we're utilizing here. The switch is highly powerful. And if you overdo the switch, you get an overload on the nervous system on certain people, especially the people who are in the greatest distress and most confused because they can only handle so much input. Okay, that would be an older person or a very sick person, somebody with cancer, somebody that's had a stroke, heart attack. You have to go slow because the nervous system can get overwhelmed very easily. Talus bone, right there where the circle is. The big bone in the heel, that's the calcaneus. And just above that is the tibia. Now the tibia is your shin bone. The calcaneus is your heel bone. Talus is right in the middle of those. So it intersects and has a lot to do with a lot of input from the body. Do you realize there's 26 bones in each foot? That's 52 bones. There's only 206 bones in the entire body. Over 25% of our bones are in our feet. How important must our feet be? Pretty darn important. And yet, you know, we throw on any kind of pair of shoes and hope they work because they feel good. Feeling good may or may not be good support for the long term. And if you wear shoes and you don't change them up enough times, in other words, if you're a runner and you don't do it every 3 months like you're supposed to, or every 300 miles, then you're going to have wear patterns that create different torsions in your body. Those torsions are going to become injuries over time because you're setting yourself up for a fall. You're an accident waiting to happen, as an example. Could be walking shoes. Yes, Pat? If the pain is in the foot, then you rub over it or you have them localized, touch it, and you still flip-flop the foot. Yep. Now, if for some reason they can't reach over it, then you can tap over it, or you can have them put pressure into it so it elicits the distress, and that will cause the body to reset itself. Okay? So you don't want to create pain, but if there is no other way for them to elicit it, then you have to get the body's attention to it. So you put the body's attention to it by touching, tapping, or they can put pressure into the area. Okay. Now this you can do for yourself, you can do for your family members, you can do for your friends, you can do for the stranger on the street. Of course, if you're on the street, you might start a parade, so you got to watch out. Okay. More pictures. That's what it looks like in the human system. Next. All right. It's a very safe technique. Only a few negative responses have ever been reported. Treatment without diagnosing a need is one aspect of it, but usually if it's acute or chronic, there's a need. Okay. correcting too many injuries at one time in one visit might fatigue the nervous system. What if they rolled their car? That's not just one area of injury, their entire body's in distress. Okay, people in here have probably had their car rolled once. Or if you're like me and you ski a little bit out of control and you fall, it's not just an oops and a fall down, it's what we call a yard sale. There's stuff everywhere. And so that hurts. So I try not to do that anymore. I had to slow down about 10 miles an hour when I started having health issues because I just didn't have the weight on me anymore to be able to control the speed. So we're going to workshop this. So if you ever had an injury, a scar, a tattoo is an injury, a piercing is an injury, you can reset the nervous system by this simple technique. Okay? So we're going to take a few minutes, maybe pair up. And if you don't know the person next to you, that's okay. You'll get to meet them real quick. Okay? And all you have to do is, if you have a pain, even if it's not consistent, you can rub over it. I'll give you another idea. If you are, or someone in your family is having menstrual cramps, premenstrual and or menstrual, then you can put your hand over the area and flex the head. That'll help reset the nervous system. Does it take it away completely? No, the next technique will. Okay? This is just one aspect. So if you will find a partner, pair up, and just go over the person's bodies where they've had injuries, surgeries, tattoos, piercings. And we could be here for an hour for some of you. I know. That's why you wear clothing all year long on your body. But go ahead and reset. And if you're having questions, I'm going to come around and show you how to do it. Questions? You're going to put the hand right here. You can do it yourself if you want to do it yourself. Make sure your feet are flat. And do you have a sore spot somewhere? Okay. Well, then put your other hand up here. Nope. Right here. Flex your head down. That's it. It could. Go ahead and put your hand on your shoulder. Okay. Tingling? Yep. Mm-hmm. Just flex the head gently. Put the head at the base of the skull. Flex the head gently. That's it. Just once or twice. Once or twice. Better? Okay. So when you do this, if you do help somebody, people consider it a miracle. And I see miracles every day because the body simply understands how to help itself, and you just have to know where to push the right buttons. Yes. Sure.
So what's the difference between what you do and chiropractic? Because it's more bone and just like right now I feel like I'm achy all over. I think it's different.
Chiropractic is muscle and bone. Okay. Has everybody figured out their injury patterns and how to reset through the occiput and or through the foot? I didn't get you as far as you. I am so sorry. Where's your issue?
And I was not.
Yes. Okay, so I had the question, well, how long will this last? If the injury is acute or chronic, it'll last indefinitely unless you re-injure the area. Because you're flipping the switch, it's on. The switch can get turned off through physical, chemical, emotional, thermal, electromagnetic, and toxic stress, whatever the influence is that caused it in the first place. So if you reset the nervous system, you give yourself the opportunity to heal faster because you've cleared out the pattern of inflammation and injury. Okay? When we strain a muscle, well, let me go through some definitions. A sprain, S-P-R-A-I-N, is a bone-on-bone injury. And there's no blood supply to the bone because there's no muscle in between the bone. So that's like your wrist, your spine, your ankle. Okay? They can get sprained. And it takes longer for those to heal because there's no direct blood supply. But you can turn down the flame of that injury by just doing the simple technique we showed you. And that allows for it to heal faster. Otherwise, the inflammation continues to build up, and now you're gimping along until what? A week or 2 or 3 later, and it eases up because that's how long it takes for a sprain. Problem is now your body's adapted to this kind of gait, which is not healthy. The body resets itself neurologically every time you take an appropriate opposite arm and leg gait step. Okay? This balances the nervous system. If you're doing this, Walter Brennan style, okay, that is contraindicated for any health because you have now altered normal physiology and mechanics in the body to adapt to the injury. Now, over time, the body can reset itself. But how much time do you want to wait? A week? A month? A year? Bad idea. Let's deal with it today. Clear out the pattern today. You can do that. Your nervous system allows for you to do that. Why? Because God gave us an incredible body. It's designed to heal. But we create interference, knowingly and unknowingly, all along the way. So, you have strains. Strains are soft tissue injury. Soft tissue is your muscle, your ligament, and your tendon. Tendons attach the muscle to the bone. Ligaments are supportive structures, but only supportive in the sense that they help guide the movement of those areas. They're not like strong as muscle. Muscle's strong. So when you have strain, there's blood supply to that, so it heals usually faster unless you have a tear. And actually, a strain is micro tearing of the muscle. But if you have a large tear, which I know some of you have probably had, where you get a little bump or lump in the muscle, well, that takes a lot longer to heal. But you can help reset it for at least the pain pattern so it can heal more efficiently without all the inflammation around it. If there's a fire burning, remember the 2 trade towers we had in New York that came down? It took 9 months for the fires to go out there before they could go and start taking out the wreckage. They had to wait until all the fires were burning down. You don't want to wait 9 months in your body for something to fire go down. Reset it now. Put the fire out. That's what we're teaching you to do. Put the fire out. Okay? Strains and sprains can be helped with this technique. Okay. So, I will restore health to you and heal you of your wounds, says the Lord. That's what this technique is. We've been wounded. We've been wounded physically. We've been wounded chemically, emotionally. We want to be able to not wallow in it, but survive it and get out of the cesspool of this pain and the stress that we're living in. Nobody likes to wallow in their own mess. And if you do, you need to get a little help for that. There are people who have adapted to their misery, and it's a woe me kind of misery, and that's who they become because they identify with their issues, whether it be cancer or whether it be, an injury they had where they had maybe the missing part of a limb. They adapt to that, but emotionally, there are ways of resetting that, and that's the last thing we're going to do today. So the second thing we're going to do today is if the last technique, IRT, which is for injury recall technique, fails to show an injury pattern, or if cleared and the patient is still experiencing pain, which happened in this room multiple times, it got better, but it's still there. The next technique is called set point technique. Hello? Okay. And you have what we call beginning and end point acupuncture head points. Now, how many people here believe that acupuncture is of Satan? Well, there are people that believe that acupuncture is of Satan. I just want to disprove that for a simple reason, because God made our bodies, and he put the points in and on the body. So if God made the body, he made these points for us to discover and utilize. Is acupuncture of Satan? No, it's of God, because it's of the body, which was his perfect form for us. Now, the philosophy and religion of acupuncture is a whole other story. If you want to worship the body or worship the philosophy that is acupuncture, well, that is not of God. But the acupuncture points are. And so I have had many people come, well, I'm not sure about acupuncture. I don't like the needles. They're afraid of the needles. Well, there's other ways to stimulate, which we're going to show you. And, they're just worried about all the Asian people and philosophy, and most of the people that are doing acupuncture are not necessarily of a Christian background, but they have great skills to help your body. So you can always pray protection over you if you go see someone that's not a God that's practicing. I see a wonderful woman. She is not a Christian, but she is excellent at her art. So I just go in and protect myself every time. And the Lord's there healing all the time. I had a session yesterday, actually. So acupuncture in and of itself is of a health type of scenario. Now, Miss Anna, would you help me, please? I'm going to hand these out so you all have a different understanding of. I'll let you take your side. I'll take this other side. These are going to be the roadmap for you helping your body and your family's bodies. I think there are 2 there. My brother had these developed. My son actually put it on the computer for him. I actually have laminated ones if you want, but those have a cost to them. You're welcome. And last but not least, okay. I think there's not quite 6 there, but I'll let you pass those down. I'll get the rest. Here you go. Very good, Philip. I think there's 4 there, and you'll need one. Anybody not have a handout? Too many sticking together. Thanks, Anna. Dr. Anna Davia is a colleague, as is my good friend Dr. Tracy Watson over in the corner there. And they have learned the applied kinesiology. They are just here to help support and also learn a bit. But Dr. Davia is in full-time practice. Dr. Watson is a good friend who I've known since I got to this state back in 1983. And he's one of the first practices I visited, and he was already on top of the game. He was doing acupuncture before anybody else was doing acupuncture. Excellent chiropractor, retired, which I'm trying to figure out, as I said, but good friend, good colleague, excellent physician. And Dr. Davia she's been out 11, 12 years and has shadowed me for a good 1.5 years in my office so that she could learn the techniques, so when I retire completely, I can pass my patients on to her. So, the acupuncture head points, let's take a look at them. They are numbered. Now, it's not important for you to understand that it's the stomach point or the bladder point or the kidney point. It's important for you to understand cause and effect. So if you take a look at, say, let's go back to our menstrual cramps, whether it be you, your daughter, or a friend. If you look on the sheet where the abdominal area pain is, oh, you can't be serious. Lost my screw. This will be fun. If you take a look at number 2 or number 3 on the head points. Okay, look at the head points. Number 2 and number 3. 3 is the bladder point, 2 is the stomach point, and then reverse, go the other side and see where 2 and 3 is. 2 and 4 intersect, 3 is in there. If you put your hand over the pain, and usually I find number 2 point, which is below the center of each eye on the eye orbit, okay? And you hold that for abdominal pain. It doesn't have to be menstrual, it could be digestive. If you're having cramps from bloating and gas, you can actually tap these points while holding the area. All you have to do is have your hand there. You don't have to rub it, you don't have to do anything. And that will clear the pain pattern. So those of you who are having a knee pain, then you would look at number 2 or number 4 to tap there for your knee pain. So 4 is gallbladder, liver. 2 again is stomach, spleen. And depending on where it's either in the front or on the side, you would want to tap one point or the other. Elbow pain, because there's an elbow pain in the back there. Tennis elbow is on the top. Where'd she go? Oh, there you are. Okay. So if it's on the top, that's number 1, I think, as it said. If it's on the bottom of the elbow, then it's number 6. Yep. Getting old is just not fun. So it's as simple as holding the area and tapping. Tapping where you see it is on the face point, holding the area that corresponds with the number on the face. So, as I said, these are simple techniques. You don't have to memorize this. You've got it. If you want something more permanent, I've got a few for sale that are laminated, so you can, not have it all bent and torn up. But let's go through that. Okay, so you had an elbow issue. Where's your elbow pain? Okay, so it's right on the bone there. Okay, and so that would correspond, since that's on the top, put your hand on it. That corresponds with number 1. So number 1 in the face is right where the nares comes into the face. So it's above the first incisor. And all you have to do is tap above the face. Now, if you want to do it yourself, you just hold the place and tap with 2 fingers right there. So go ahead, and your tapping is important to realize there is a pace that will work best for you or whoever you're working with. If they're more healthy, you can actually do a faster pace, and that would be maybe 3-4 taps a second. Keep tapping. It takes a good 100, 200 taps. Okay? If the person is of relatively good health, probably 1 to 2 taps a second. And if the person is fragile, sick, or has a lot of other health issues, you probably want to do 1 tap a second, because you can overwhelm the nervous system, just like flipping the foot too many times. That overwhelms the nervous system. You can tap too fast. You can't really ever tap too slow, but you can tap too fast, and the nervous system will not catch up. It doesn't have the capacity if they're that distressed. So a good place to start is maybe 2 taps a second. So you can do this on yourself if you want. If you have a pain area, just go ahead and put your hand on the area of distress and tap on the corresponding head point where your hand is. And then I'll tell you another way to help yourself after that. So let's go ahead and take a break and do that, and I'm here to help you. Well, if the pain is near or where the point is, then you just kind of hold in the area and tap at the area at the same time. Okay? So if it's like a frontal headache, which a lot of people have, the frontal headache, you're going to have a number 1 or a number 2 that runs right through that if you take a look at the page. Okay? Acupuncture for bladder comes right here and goes all the way through the spine and all the way down the back of the leg. The acupuncture meridian for stomach, okay, right here, runs all up and down. So if it's a tooth problem, a jaw problem, an eye problem, usually a frontal problem, it's a stomach point right here. Okay, how's your elbow? Okay, so press on it where it hurts and then tap, and press and release while you tap. Okay? But everybody should be tapping right now if you have health issue or if you have area of pain. Mm-hmm. So where are you feeling your pain? When you do feel it, where do you feel it? You said when you're stressed.
I don't know if I feel, I might not be thinking, but say I'm at work and I get overwhelmed at work, and sometimes that stress comes up, I might not initially feel the pain, but because here it said.
Okay, that's the third technique. So, anybody seeing results from just tapping? Pardon? Okay. So you want to hold the area of the jaw and tap. So you can tap both sides of your head with one hand while holding the other area. That would be the most effective way of doing things. That's fine. You can hold your hand and tap on the area of involvement. Okay? No. Well, you could. I mean, it just depends on how long or big your hand is. Yes.
Lower back would be 3 or 7 if it's spinal.
Lower back would probably be 1. Or, well, let's see, 3. 3 is bladder, 3 is bladder. Yes, would be 3 or 7, which is right down the center of the spine, which is right above the lip. Right above the lip. Yes. Eyes are usually going to be stomach point because the acupuncture meridian for stomach runs right through and around the eyes. And usually if there's a frontal headache, occipital headache, pain behind the eyes, pain in the temples, that's a toxic headache. So you've eaten or drunk something or breathed something that is causing your nervous system to be out of or in distress and out of normal. If you have a frontal headache, temporal headache, sinus headache, occipital headache, it's usually the stomach acupuncture meridian, which is right here. So you put your hand where you feel it, and then tap right here. Yes. Oh, good. Ears are going to be either stomach or gall. The key is not which fingers you use, but just to tap in those areas and to stimulate with your own skin and your own energy. If you use something electromagnetic, if it's the wrong frequency, it can actually short circuit your nervous system, and that's not healthy. So I don't do a lot of electromagnetic acupuncture. There's a German named Voll who designed a whole technique called electroacupuncture by Voll. And it was quite therapeutic, but if you put the wrong frequency, it actually made the problem worse. And so your body knows its own frequencies. Even if we don't, your body does. So if you tap, you can reset pretty efficiently. If they are grounded sheets, the question is it okay to lay on electromagnetic sheets? If they're grounding sheets, that's different. If there is an electricity, like an electric blanket kind of thing, where there's electricity, it's usually short circuits the nervous system. It relaxes, yes, it warms, but it also short circuits. Yes? Absolutely. You don't want anything electromagnetic on your body while you're doing these techniques because you are changing the frequency. So if you have keys, a watch, a Fitbit, a phone, if you're in front of the computer, give yourself a minute and just to get away from the computer and do it. But yeah, electromagnetics can interfere with anything because we're electrical in nature. A lot of people sitting in front of a computer all day have physical distress, not just from their posture sitting at the computer as they get bent over all day, but the electromagnetics suck the life out of them. It's just the nature of 5G anymore. Yes? You're literally flipping a switch. It's just helping flip the switch. The tapping is a different form of switch. Okay? So that's what you're doing. You're resetting an acupuncture meridian. Now, an acupuncture meridian is an energy meridian. People don't like to talk about energy, but it's an energy meridian. And the body flows in the acupuncture system headward to footward, headward to footward, headward to footward. So what happens if you have an injury or if you have a circuit that's off in the acupuncture meridian? By the way, there's over 50-some pairs of points. Okay, that's almost 2,000 points on the body that can short circuit. But tapping resets it. And if it takes longer to reset, it's probably because there's more points that are in distress. Yes?
A wand off bullet, but every morning I
it stimulates the nervous system, so it'll get, blood flowing to certain areas, and it'll allow for the body to have, an input. And if you see benefit from it, then that's good. If you're still waiting for the benefit, then it's probably just beating yourself up. And some of us love a good beating anyway. I mean, we deserve it, so. Okay. How many people had improvements from the tapping? Okay, let's raise them up. Okay. So this is something that will benefit you or a family member. It's good for long-term distress because the longer you have the inflammation, it just keeps accumulating. And then it stagnates. So people who are swollen, people who have injury. My knee, when I had my knee injury, didn't swell up like this. It was maybe about 20% larger. That's about it. Just a fat knee, not a overly injured looking knee. And I had to limp around on it for a couple months until I had to have the surgery. But there was no pain. I took a Tylenol that night. Hate to admit it, I did. And then 2 weeks later, I took another Tylenol because the weather was changing. It threw off my nervous system. That's it. I had 2 Tylenol for a completely obliterated knee. You don't hear that. That's because I don't put things in that create inflammation, and I also reduce the pain and inflammation through these techniques. These techniques have been around since the 80s. Okay? If your chiropractor isn't using them, it's because he's not a kinesiologist. He's still a good doc. If your medical doctor isn't using them, because he's never been exposed to it and doesn't think it has value, or he'd already be using it. Okay? Drugs and surgery are the last thing you want to do to your human body, not the first. By default, since we are not educated in how to help our own bodies, we start with drugs, and when that doesn't work, we go to surgery, and by that time, it may or may not relieve the problem. Most of my patients that I see have had multiple surgeries for the same problems, and the problem keeps coming back, whether it be a back issue or whether it be a knee issue, whatever. And all they have to do is reset the nervous system and then take care of the diet that's creating the inflammation. And a lot of people don't want to give up their beer. They don't want to give up their wine. They don't want to give up their pizza. I had this discussion. I talked about it when I was working with my brother. Just started out with him, and he told me, he says, John, if you want to get better, because I was a mess. I had 7 out of the top 10 killers going on. I just moved, just gotten divorced. I had major health issues. I had no money. I had no job. It's like, that's 5 right there. No friends, another one. Had my brother, but it was a new area. So it's like, he's talking to me, he says, John, if you want to get better, you have to stop drinking beer, eating pizza, and chewing tobacco. I go, well, I don't want to do that. And he goes, well, then you're still going to have your problem. I said, well, I don't want my problem. He said, well, if you don't want your problem, literally, this circular conversation, which we've all had with certain people who just don't get it, and back then I was completely confused nervous system. I didn't get it. Well, I don't want to give up my beer, pizza, and chewing tobacco. I said, well, then you're going to have your problem. Well, I don't want to have my problem. So after literally 5 minutes of discussing this with my brother, I say, you mean to get well, I have to stop drinking beer, eating pizza, and chewing tobacco? Because, it's just like any psychological issue. You have to admit to your problem before you can actually address it. He goes, yes. I uttered a few obscenities, and then I said, okay. Because I wasn't happy about giving up my lifestyle. But if you want to change your life, you have to change your lifestyle. If you want to be well, you have to do healthy things. You can't just pray God's going to fix it, because God can. But what if he doesn't? Does that mean you're a bad Christian? Does that mean God doesn't love you? No, we make choices. If we make poor choices, we get poor outcome. You step in front of a bus when it's moving, that's a bad choice. It's got a lot of repercussion. We know about people. Everybody in this room knows somebody that's an alcoholic. Bad choices. It's a disease, yes, but it's still a choice. Diseases can be overcome. you have to make appropriate choices if you want to get well. Well, how do I find that out? And a few people like myself and Dr. Anna and Dr. Tracy were there to help people out because we look beyond the spine. We look at the whole body. But what if we're not around? Well, you can determine if something you're eating is poor for you and poor for your health if you lose energy eating it. Food is supposed to stoke the fire of energy and not put the fire out. If you're tired after eating, you just ate something to which you're sensitive. It's really that simple. There's something called the Coca pulse test. Dr. Coca designed it. If your heart rate goes up 10 beats or more after eating a substance, you're probably sensitive to that substance. So you get a resting heart rate. You eat something, or I just leave it in the mouth, because as long as the brain knows it's there, the body will be happy to identify it. And then you measure your heart rate. And if it goes up 10 beats or more, you're sensitive to that food. Get it out of your system. Get it out of your diet. Get it out of your lifestyle. Well, I've eaten it my whole life. Well, yeah, let me give you an idea. For every major trauma a person has, there's a high probability they become sensitive to another food group. What? Yes, whether it be a surgery, an injury, a divorce, something other emotional. For every one you have, there's a high probability you become sensitive to a different food group. Well, it was okay yesterday. Yeah, but that was before the car accident. The body's resistance to certain things is lowered under distress, whether it be physical, emotional, chemical, thermal, electromagnetic, or toxic, and it no longer has the ability to keep you from having your issues with the other food sources. Okay? So that's something we taught a lot about in November. Last thing we're going to talk about. This one's going to take some time because I'm going to have to help you all out with a lot of it. So, have the patient therapy localized over an area of pain, tap the corrected head point until autogenic facilitation, well, that's muscle testing. Pace the frequency of tapping in accordance with the patient's ability to process it neurologically. Okay? We did the workshop. Got ahead of myself. And another. So, if you have constant pain, you might have to put the area of involvement in motion while you're tapping, okay? And if you put the area of motion in while you're tapping, or you can press on it to elicit the pain while you're tapping, that is called a nociceptive technique, and it will reset even more efficiently. So it's still tapping, putting your hand on the area like with your elbow, and it will get better if you keep pressing on it. Because you have to elicit, sometimes if it's an old injury, you have to elicit the problem so the brain can remember, oh yeah, we got a problem there. Because the body will hide the problem, put it on the back burner so it doesn't have to deal with it. Why? Because we don't want to be in pain all the time. But then we have another layer of injury and another layer of distress that the body has to work through to try to get well. Clear out the layers, and it's a straight shot to healing. Don't put the toxins in your body that create distress, and you have healing faster. Okay, so this is my technique. It's called, well, I'll get it to you in a second. This is the Bible passage I was reading because I was in great distress, emotional distress at the time. And it's Romans 5, 3-5. Even in times of trouble, we have a joyful confidence, knowing that our pressures will develop us patient endurance. So troubles create patience, and patient endurance will refine our character. So patience causes character, and character leads us back to hope. And this hope is not put one to shame, because we can now experience the endless love of God cascading into our hearts through the Holy Spirit, which lives in us. Let's remember the healing power of Christ is in us 100% of the time. Well, how come we're not getting well? Well, there's something interfering with it, or the body is in too much distress and it can't tap into it. Is that possible? Yeah. All the time. And what happens is we get so focused on our own health, we forget about who's in charge. Christ. So if we have everything working for us, there's a higher probability we'll clear out the problems that are causing us distress. Whether it be physical, chemical, emotional, thermal, electromagnetic, or toxic. So, we had our Pastor Mike last week, his sermon talked about when you have great hope, you have great joy. How many people are lacking joy? How many people can walk into any situation with joy? Those are people who are most well. Those are people who have great hope. Those are people who have lifted up their issues to God and God's taken them. But what if he doesn't take ours? Well, maybe there's something interfering with that communication. Okay? And we don't want to interfere with communication with God. We want to have a straight path. We have Christ. But if we're too focused on our own issues to appreciate where God is working in our life, and this issue might be to draw us closer to him, I got to tell you, you have 7 surgeries in 8.5 years. You either draw close to Christ or you die. I've been there. Should have been dead a few times. God had a different plan. I'm happy for that. Okay? But the end result is you have to see that it's not just God, it's a team effort. Christ told the 10 lepers to do something. They had to go wash in the Jordan, 7 times? Okay? Sometimes you have to do something to get the response you're looking for. There are miracles every day. I see them every day in my office. Even if I see one patient, I see a miracle. Because there are things that are happening that are just outside normal understanding. But sometimes the Lord asks us to do things, and we need to do those. We have to understand what they are. These techniques will help you get through some of your situations more effectively. Heart focus technique. He heals the brokenhearted and binds up their wounds. Well, I was in great distress emotionally, so this will help with emotion, it'll help with physical pain, it'll help with any type of distress you're having. But I'm sitting there going, Lord, how come you're not listening to me? Well, it wasn't him not listening to me. I wasn't listening to him, but who's going to know that when you're in distress, right? We always blame God, but it's like, well, John, what didn't you do? I didn't do a lot. Had to come around a long way. Heals the brokenhearted. There are a lot of people in here who are just wounded. We live wounded. That's not the way Christ and God want us to live, because Christ died so we have won the war. But we're still fighting battles out there because we're not in heaven. We're in, the world. So if we're constantly fighting battles, there's a possibility that we get wounded. And some people don't know how to fix their wounds. They don't know how to not keep wounding themselves because they make poor choices. So, if right up below the sternum, at the base where that little knob is, if that is sore, you probably have an indication for this technique. Okay? Now, if it's not sore, you can still have an indication for it. That's what they call alarm point. It's an acupuncture point. It lets you know whether that particular acupuncture system is in distress. Heart focus procedure, I developed it back in 1998 and 9. You focus on different appreciations. So the HeartMath, Institute of HeartMath is in San Diego area. My brother knew most of the people there. The patient focuses on different appreciations. It can be of a person, a place, a thing, an event, or a situation. One of them will strengthen. Well, I'm going to muscle test you all and find out which one it is, because you need to know what this is. You fill your heart with this sense of appreciation, and you feel your heart fill with that feeling of appreciation. And then when your body is feeling like your heart is ready to burst, you let that appreciative feeling overflow to your entire body or to the area of most need, whether it be your ankle, your knee, your back, your head. Okay? And then you close your heart back up and you fill it again. Every time you breathe in, you fill your heart. Every time you breathe out, you blow out the negative emotion. Breathe in, you fill your heart with appreciation. Really? Really? Nobody I know. So if it was spam, it would be my child. And you have to understand why I feel that way, because if I ever have another child, not likely, but if I ever have another child, I'm going to name the child Spam, whether it be a boy or a girl. And you may ask why. Because I'm guaranteed to have a call from my child at least once a day. And those of us who have kids want to hear from them periodically. Not from the jail cell, I assure you, but still, we have them. So, breathe in, fill your heart filled with appreciation, breathe out, and breathe out the negative stress, and fill your heart fill. Once your heart feels full, let the heart open up, let that appreciative feeling flow throughout your body, or send it to an area of most need. So, we communicate to God through the heart. That's how we speak to God. Okay, last November I talked about how the heart, actually not the heart, but the body has an anatomical temple. That anatomical temple, we communicate with God. That would be like the most high of high places in the temple, holiest of holy places. Okay, and surrounding the heart is a deep red crimson pericardial sac, which is the same thing as the deep red curtain that surrounded the space for the most holy of holy places. Then you have what's outside the most holy of holy places is the altars where they sacrificed all the wine, the animal, the grain sacrifices. What's below our heart is what our digestive tract, our stomach specifically, to start with, in our digestive tract, which does what it breaks down, burns up, if you will, all the things we put in it. Okay? So we have an anatomical temple in our body, and we communicate to God through our hearts. Very important to understand that. Because if your heart is wounded and you're living in fear and you're not sure what's going on and you're just confused, it's harder to communicate with God, because God only communicates with us when we have a heart that's filled with love. You can't be in fear and love at the same time. You can have only one of those emotions occupy the heart at one time. You can switch back and forth on a daily basis. I've done that until I got smart. When you are filled with appreciation, that fills your heart with love. That love has specific positive energy, if you will, that negates the negativity around you and in you and how you perceive it. Realize, reality and perception are the same depending on where you live in your own mind. You want to clear out the misperceptions and misconceptions. This helps do that, especially if there's emotional distress in it. Would you stop? Must be that time of day. Sorry, I thought I'd turn this bad boy off. It is now finished. Glad everybody else was considerate of this presentation other than myself. So, next. Okay, this is where you can get a hold of HeartMath. Now, HeartMath is not a Christian organization. They have some excellent techniques. This was like their first technique. And when I read that Bible passage, it talked about patience going into perseverance into character, or maybe it's character, perseverance, hope, whatever. I thought this must be what's directly associated with placebo effect. Okay? Now, I talked to them about that. I said, no, and they said, no, probably because it's not their discovery. But if you have great hope in that treatment, in that doctor, in that pill, and 33% of the people get better on placebo. Why? Because they hoped it would work. And where's hope going? Start in the heart. And they fill their heart with that feeling of appreciation that this is going to work, this is going to work, this is going to work. And they get better. What if you had a very specific thought process that facilitated the same thing that you could use over and over and over again anytime you're in distress, whether it's physical, chemical, emotional, thermal, electromagnetic, or toxic stress? That would be a great tool. So we're going to make sure every one of you, before you leave, understands what that specific thought process is. Okay, so I'm going to do this. Yeah, we're going to do the workshop now. So I'm going to go around. We got a half an hour, and it shouldn't take that long. I'm going to check each one of you out. You're going to find a specific person, place, thing, event, situation of which you appreciate. Now, it may not be something that you remember. It could be something that was remote. I had a patient who was 30-some years old. Her parents were going through divorce when she was a teenager in high school. Her thought was she was a Star Trek runner, and her appreciative thought was the solace she had after track practice, after she showered up. She would go to the jump pit where there's cushions, and she would just lay in there just because she knew if she went home it was going to be traumatic. That was her place of solace. She didn't remember that, but we found that through the nervous system. So it could be something completely obscure. It could be something like God, your mother, winning an award, helping somebody out, somebody helping you out. It could be something simple as that. But we're going to go through all that. I'll turn this off so not everybody has to know what you're thinking. And if you want, think of an appreciative thought right now and just practice this technique. And it takes about 10 minutes, sometimes longer, but the more you do it, the shorter the time between getting the results you're looking for and starting the process. So it might take 15 minutes now, but in 2 weeks it might take 1 minute. Because the more you utilize it, the faster and more efficient it works for your body. So we're just focusing on the breath and breathing in. You're not touching a certain area, but when you release the appreciative thought, you want to focus it on your knee or on your head or back or on your elbow or wherever you're having the pain or distress. If it's emotional distress, just send it throughout your whole body. Okay, because any emotional distress affects every aspect of the body on a cellular level. They don't have to be. Nope. You can be lying down, standing up, standing on your head if you wish. I wouldn't do that, but I couldn't do that. Okay. So it may not be the first thought you think of, and that doesn't mean you don't appreciate those thoughts. However, there is one very specific one that will yield the greatest result, and that's what we're looking for. So if you want, while, this half of the room, maybe start thinking about appreciative thought until I get over there, and then you can just kind of rest. Now you can put yourself to sleep. If you have sleep issues, this will put you to sleep. Okay? If you have energy issues, this revitalizes you on a cellular level. It'll help you out.
I'd like to make a statement for everybody. Diaphragm, when you breathe, your chest should not expand, your abdomen should expand. So it's very important that you reset that reality. Forgive me, John.
Watson's completely correct. When you want to breathe in a most effective way, you don't breathe from the chest, you breathe from lower down. Okay? That fills you faster. Maybe takes a half dozen to a dozen breaths to fill the heart. And then you just close the heart back up and do it again. And keep doing it until you feel that inner peace. patience while we went through that. Please write down whatever that thought was, or that person, or that event, or situation, or place, because that is your nervous system's primary support. Something during that time gave you the ability to have a better outlook in life, a whole body level, body, mind, spirit. I know it. I know it's just something's not working. So if you are able to focus in on that, and it doesn't even have to be for the full 10, 15 minutes, it can just get you out of distress so you can move forward in that moment in time or in that day. Give yourself the opportunity to help yourself, because your body deserves every positive input that it can take. And if your body is in distress, it doesn't know where to search. But if you have this written down, you have this tacked up on a mirror or on a refrigerator or something, you go there, I'm not doing well today, boom, you go right to that thought. Okay? And focus on that, focus it in your heart, let your heart fill with that feeling of appreciation. And once your heart feels full, and you see your heart open up, let that appreciative feeling flow throughout your body, or to an area of need if it's in physical distress or some sort of pain. And then you close your heart back up and you do it again. You do it for as long as it takes for you to feel that peace that you need. The more times you do this over a period of months, the less time it takes to get the same result. Okay? Now, if we could, what do we do next? Okay. Thus says the Lord, I've heard your prayers, I've seen your tears, surely I will hear you. I will heal you. So the Lord wants us to be well. He hears us. But sometimes we have to do something on our own. Something that's focused on the spiritual nature of the Lord. Something that's focused on the spirit in our heart, which is Christ. Okay? That's really what we're doing. We're not doing some esoteric, new age kind of thing. This is focusing on the love, power, and healing ability of the Holy Spirit, which is in our heart. That is what you're focusing in on. That is what you're tapping into. We all have that. As Christians, we all have that. Even if you're not a Christian, you have it. You just have to understand how to use it. Okay? So, the Lord doesn't want us in tears. He doesn't want us in distress. He wants us well. And He will heal us. Sometimes we have to do something to elicit that. Last slide, please. I think it's last. Come to me, all you who labor and are heavy laden, and I will give you rest. That rest means peace. It gives us the opportunity to take a step away from our distress and be in a place closer to God so that we can appreciate the love and healing and just support that He has for us and protection. The world's a crazy place. It's not getting any easier. I've got a ball cap, I think my friend Tracy gave me over here. It says, normal isn't coming back, Christ is. Okay? Normal isn't coming back. If you're waiting for normal, it took a bus. Way out of town. Okay? Abby normal's here, but normal's not. So you want to give yourself the opportunity to be at peace. So many people I know most of the time people are saying peace, they're in distress because they want that peace themselves, and they think if they give it away, they'll get some. And that happens. It sure does. But to live in a state of peace means a state of health and well-being because your body's not so busy, not so confused. These techniques will help to take you out of your physical pain, take you out of your emotional pain, take you out of different distresses from the past, the present, hopefully not too much in the future. But what I want you to realize is you have the gift of healing. We all do. I just focused on it because it's one of my gifts, but you all have the same gift to heal yourself and help others. That's the important thing to understand. We are not just flesh and blood. We are spirit. And that spirit screams to come out of us. And yet, we're too closed in sometimes. This will open you up. This will free you to be able to become the child of God who you always thought you were and always could be. And I welcome the opportunity to see your shine throughout the community.